A very serious byproduct of COVID-19 is the loss of trust in public health agencies. The future consequences could be deadly. Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. Before the pandemic, most people believed that public health agencies such as the Centers for Disease Control, the Food and Drug Administration, the National Institutes of Health, and the World Health Organization were staffed by scientists, physicians, and researchers who reached conclusions based on actual data. That faith has been shattered. If a new pandemic or some other health-related crisis arises, people may ignore warnings and recommendations with unforeseeable and perhaps mortal results. The behavior of these government bodies has too often been wrong or guided by politics. When COVID-19 began to emerge, the World Health Organization took its talking points from China, whose Wuhan Institute of Virology was notorious for slipshod safety practices. Precious time to sound the alarm and begin safety measures was lost. In one of the most disgraceful episodes in modern science, certain public health officials like Dr. Anthony Fauci went out of their way to silence any discussion that the virus might have originated in the lab. The cover-up ultimately failed as more evidence emerged. Bureaucratic to the core, the CDC botched its initial COVID response by insisting it create its own testing kit. Hospitals were initially barred from using their own tests. Unnecessary death resulted. Experts insisted on draconian lockdowns, even when the evidence became clear that these at best merely delayed but didn't eradicate the spread of the disease. Yet today, China is brutally enforcing lockdowns that are literally starving people to death. Early on, experience showed young people, except in special cases, were largely immune to the disease. Nonetheless, teachers' unions demanded public schools stay closed for months on end. The shocker here is they successfully pressured the CDC to go along. Millions of youngsters, particularly those from low-income households, have suffered serious setbacks in their schooling. So much for the science. The bad behavior by public health officials continues. They suppressed or played down the fact natural immunity is more potent than vaccinated immunity. Millions of people who had natural immunity were fired from their jobs for not being vaccinated. The FDA says people aged 50 and over should get a fourth shot, even though there is no clinical evidence that a fourth dose reduces hospitalizations. The FDA has been slow-walking approval of 2 vaccines that use traditional time-tested technology and that have been green-lighted in other countries. The National Bureau of Economic Research just came out with a working paper that measured the impact of the lockdowns in each state and the District of Columbia using 3 metrics: mortality, education, and the economy. The bottom line, states that employed severe lockdowns generally did no or little better on the health front and seriously worse in education and economic damage than the states with much milder policies. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions. I look forward to being with you soon again.